For over a decade, civil war ravaged the West African country of Liberia. In its aftermath was left horrible devastation and chaos. Health facilities all over the country were destroyed, and Liberians were dying of illnesses that would have been easily treatable in the United States. This was especially tragic as the women who so bravely organized to stop the Civil War and bring democracy and peace to Liberia were dying at a time when they were needed to keep families together, open markets and schools, and to care for their children and husbands. Smaller, local communities were hit the hardest. They were left with no safe, sanitary, effective, reliable health care for their residents. Today, in a country of 4.2 million people, there are only 50 doctors.
To our sisters and daughters in the United States, Liberia has had some hard times, but today we are rebuilding. We're trying to reconstruct our country, trying to bring dignity back to our people. I appeal to each and every one of you to join this crusade that will bring to our children, our mothers, our sisters, our daughters, the kinds of quality health service that they need.
Dr. Chris Henna, a Liberian-born United Methodist medical missionary who had spent decades implementing successful community-based healthcare programs in many other countries, heard the call and returned home to lead an effort to better care for her people. Since returning in 2012, she has been working to reform the Liberian healthcare system through an initiative called Healthy Women Healthy Liberia.
No, not really. Yeah, what's wrong with you?
Prevention, and more prevention. That's going to be the theme of our work here.
Based in the city of Kakata, Healthy Women Healthy Liberia has transformed the face of healthcare in Liberia. They are providing health education, operating medical clinics, and training community health workers across 35 local communities in Magibi County, a county of over 200,000 people. Their goals are to implement preventative care programs that focus on improving maternal and infant health, improve the nutritional status of women and children, restore and maintain water and sanitation, and reduce the incidence of non-communicable diseases. Without a traditional facility, Dr. Henna, one of the country's few doctors, provided health services and medicine out of a one-room building, with patients waiting in long lines outside. So, in 2012, land was purchased and plans drawn in preparation for a new, state-of-the-art indoor medical facility. And in 2016, a women's health clinic opened and provides a secure, sanitary place for Dr. Henna and her staff to see patients. The new medical center has waiting space, medical and dental examination rooms, space to accommodate overnight stays for those unable to travel, a pharmacy, labs, imaging, medical supply storage, classrooms, and a state-of-the-art telemedicine service. The medical center will also serve as the operating headquarters for Healthy Women Healthy Liberia. The impact this vital ministry is making is evident. In 2013, just over 2,000 total patients were treated. In 2016, over 17,000 lives were touched in some way through the great work of Dr. Henna and her staff. The Healthy Women Healthy Liberia program has radically changed many facets of healthcare in the nation of Liberia. Under the guidance of Dr. Henna, the faith-based program continues to expand while empowering women to manage their own health and improve the health and life expectancy of every person.